So we have this lovely patient. She's 40 years old, and as you can see, she has already started some signs of aging. Always the first step of every procedure is to analyze the face, to know what are the procedures that we are going to do. I always start from the top and go down. So here you can see she's starting to have volume loss in this area. Also, we have the frown lines that are starting to show. The temple area also, she has signs of volume loss. If we look in the eye, we're starting to have hollowing of the eye. Also, the cheek is hollowed. If you look closer here to this preauricular region, there's a big volume loss. And if we look to the lower part of the face, she has a class 3 occlusion, so her jawline is still showing, but there is lack of volume in the chin area. You can see here the nasolabial folds are showing. That's because of her class 3 occlusion. So she always had this since she was a young child. For the temples, we have two techniques. We have the gunshot technique where we put a bolus under the temporal muscle, and I like to use the contour for this purpose. If not, we have the second technique which we can use the biovolume, and we can inject it under the skin and it gives a nice volume. We try to avoid all the vessels. We go down, we have to touch the bone. We inject slowly. We tell the patient that she's gonna feel the pressure. I put 0.5 on each side. The product we are using now is Biovolume. I want to give some volume to the cheek. I do it both sides, from up and from down. So I'm using here the cannula that is provided with the Biovolume. It's a 25 gauge cannula, and it comes with a 23 gauge needle. So now I'm going to do the cheek, actually continue to do the cheek. Always go deep. Now we will be treating the pre-auricular area. It's a very important area for her because she has a prominent jawline and there's a big loss of volume. I think this will harmonize her face. This area is not very sensitive, so we put the product subcutaneously. So now I'll be doing the under eye area. I'll be using the Bioclassic. You can always pinch the cheek to make the cannula go further. I use small boluses because this area is very sensitive, so I put a little bit of bolus. I always try to go very deep to the bone. Sometimes the patient, they can feel it on the bone. And massage. Okay, so now we're gonna treat the marionette lines. We'll be using BioVolume. It's very good for the skin laxity. So whenever we don't know where we put the needle, we try to press it. Try to inject it superficially. What I do here also for the chin is I put a little bit in the chin to make a V, to give support. I use 0.5 in this area. So we have finished the right side of the face. As you can see, she still looks the same, but she looks healthier, she looks better, that's it. If we look to the details, you can see the tail of the brow that is higher. We also put some volume here in the cheek so it looks better and lifted. The area in front of her ear looks much better. It's harmonious with the cheek. Also, like the nasolabial fold looks better because also we filled the cheek. The marionette line looks a bit better. I didn't want to inject her chin because that would change her face. So I left it as it is, but just enhanced the marionette.